Okay. Okay. Sorry. Good day, comrades. Where has it started recording? Why? Yeah, it started recording. You'll excuse my apologies. So, welcome to this very, very important webinar. It's very important because this speaks to two key elements, working class concerns and women liberation concerns, and shows how the two are actually concerns for working class activists, for trade unionists, for us as people that want a better society, people that want the liberation of a working class and equality, irrespective of your sex or your gender. And so I would not waste time any further. We have two very, very inspiring speakers, one of whom I've worked closely with in different ways for over 20 years now, and I'm always very happy to engage with her, and that is in the person of Comrade Abi Badru. Comrade Badru is a nurse, a senior nurse, who served in the National Association of Nigerian Nurses and Midwives, heading the gender department at a point in time. She was a key facilitator for the NLC education training program. And at the moment, she is project officer of the Public Services International, responsible for health work. If you're not speaking, kindly mute. Kelvin, you could help with muting while yeah, if anyone is not speak, please mute. So the other speaker I'll also invite when she introduce when she comes. But without much ado, I'll call on Comrade Abi to set the ball rolling. Abi, you have the floor. Bienvenue.
Merci beaucoup. Well done. Good afternoon, comrades and everyone on the platform. Today is very important. I want to also appreciate the convener of this webinar because it is timely. We are in the era where we have to talk about issues that concerns both men and women, especially when it pertains to equality and equity. And please permit me to close my video to make the quality of the audio stronger for me. Yeah, so. And the topic before us today is a very important topic because it talks about the struggle for gender equality and decent work in the health sector. And in that topic itself, there are so many keywords that I would also like us to explore. We have gender equality and we have decent work, then issues around the health sector. All of us, we know that health is wealth. And for every nation to, to remain stable, there is need to maintain, quality public healthcare services. So that is for sure. And now when you look at the issues in the health sector and you consider those who work mostly in that sector, we will see that the health sector is a feminized sector in that we have more women. It's a women-dominated sector. Healthcare is women-dominated. And we see a lot of inequality in terms of, the rights, maintaining the rights of women in that sector. So it is important we talk about it. We'll first do a little expose on the gender equality. What does it mean for women, especially in their sector? It means that women and men have equal rights, responsibility, and opportunities within the sector, And this does not mean that women are competing with men or men are competing with women. It simply means that all should be given equal access to resources and opportunities, equal value, freedom from discrimination and violence, empowerment, and shared responsibility. And why is this important? Because this is a fundamental human right. Every individual has the right to be treated with dignity, fairness, and respect, regardless of their gender. And is a condition for sustainable development. And in overall, it is beneficial for everyone. It is not just a women issue. Gender inequality affects all gender, and achieving equality frees everyone from rigid gender stereotypes. Then another key word in our topic is the decent work. Decent work is a very broader term used especially in terms of industrial relation to depict, a work that is decent, productive, and free, and also affording individuals freedom and equity and human dignity. So it's a balance that is also used to depict the ILO, International Labour Organization, Decent Work Agenda, in which agenda which was formulated by ILO in 1999 as a response to the challenges of globalization. And it aims at a social dimension to the global economy. And there are 4 pillars to decent work, according to ILO: employment creation, which also involve sustaining jobs, guarantee the right of workers, that is their right to freedom of association, elimination of forced labor, abolition of child labor and discrimination in the world of work. And another pillar is the social protection, and the last pillar is social dialogue. All these are very important in the discourse of decent work, and also very important in our discussion when we look at, the struggle for decent work, for gender equality and decent work in the health sector. So we also want to point out that the struggle for gender equality and decent work in the health sector is a multifaceted issue with significant implication for both health professionals and the quality of health services globally. Despite women comprising the vast majority, according to WHO, about 70% of workers in the sector they face pervasive inequalities, hindering their career progression, economic empowerment, and overall well-being. And these challenges are numerous, but I will try to talk about few, and then we will continue. Colleagues in the room can add to it afterwards. These challenges include underrepresentation in leadership. While women deliver health, men predominantly lead it. Only about 25% of senior roles in the health sector are held by women. Then another very important challenge is gender pay gap. The health sector exhibits a significant gender pay gap, estimated to be higher than in any other sector, that is up to 29%. This is due to occupational segregation, where women are clustered in the lower status, lower paid, and often unpaid roles, such as nursing, midwifery, community health work. And the labor of love meat, which the value care work predominantly performed by women, contributes to this undervaluation. Then we have another challenge, which is underpaid work. A substantial proportion of women contribution to health, estimated at around $1.5 trillion globally, come from unpaid care work that women do. Millions of women work in unpaid or underpaid community health roles, essentially subsidizing health system and missing out on opportunity for formal education and paid employment. Another key challenge is workplace environment and discrimination. And this is predominantly in our patriarchal society, where women frequently encounter overt and subtle forms of discrimination, sexism, harassment, and unequal treatment. We also have the challenge of work-life balance and family responsibilities. Women often bear disproportionate share of household duties, including childcare and elder care. And this creates a dual burden of care, which also impede women in advancing, in the workspace. Another key challenge is lack of mentorship and leadership opportunities. Inadequate mentorship, limited networking opportunities, and systemic barriers impede women advancement to senior positions. Another challenge, which I will be the last, I'm going to stop when it comes to the challenges of gender equality in the health sector, is security and safety concern. In some contexts, particularly fragile and conflict states, women face additional challenges due to gendered sociocultural norms and security risks, including physical harm and gender-based violence. Nigeria health sector, especially workers in the Medical and Health Workers Union and NAM, have suffered a lot in this area when it comes to issues of security. We have had instances where health workers were kidnapped by Boko Haram, beheaded, some, turned to slaves, and some were lucky to, regain their freedom. But this is a very, very, concerning and very disturbing challenge when it comes to, gender equality. The women are more vulnerable to being captured, being abducted by militias than the men. So what are the challenges that is impeding achievement of decent work? Staffing is a very key challenge because number one, like we said earlier, women are underpaid, especially in the developing countries. So there is that tendency for healthcare workers to want to migrate to greener pastures, and in that way, they create a vacuum, an acute shortage. A global shortfall of health workers, estimated at 18 million by 2030, leads to excessive workloads, long hours, and high turnover rates, contributing to burnout. Low pay and financial pressure. Many health support workers are engaged in low-paid jobs. Very critical, to this discourse is the issue that most states now, instead of employing, newer healthcare workers, is creating, a precarious form of employment called contract to healthcare workers, instead of giving them permanent jobs and increasing the numbers of health workforce. The government is, privatizing or making precarious situation, working condition, very, very, visible in the health sector. Another one is the workplace violence and harassment. These health workers are vulnerable to violence and sexual harassment. It's a significant issue, particularly for women. So I have mentioned this, and it's still a very cross-cutting critical challenge when it comes to attainment of decent work for women. Then another critical point is inadequate social protection and rights. Informal workers, especially health workers, they lack access to social protection. And for those in the public space, so we have social protection, but it is very, very ineffective. For instance, issues of housing, issue of health insurance. Most health insurance policies by government does not cover critical health care that women might need, especially to their own gynecological care. Occupational safety and health. Despite the demanding nature of women's work, health workers' work generally, health workers face the risk from physical, chemical, psychosocial hazard, and there is a need to address this. Another very important point in this term is also the issue of limited autonomy and decision making. Despite the critical role in service delivery, many health workers, especially women, have limited input in the design of health plans, policies, and systems. For me, this is very important. I feel the absence of women when governments are designing healthcare facilities and hospitals. Most of our hospitals, especially the antenatal care, are just open halls with curtain screen. This does not provide dignified care to women, especially in the time of vulnerability like labor. And I believe that it's because most of these designs were done by men who will not factor in, the vulnerability of women in those circumstances. And there is need to, give room for women to participate in the design, in the policy, and in the plan of the healthcare system in Nigeria and also in other parts of the world where this is lacking. So achieving gender equality and decent work in the health sector require a gender transformative approach that aims to fix the system, not just for women, but for everyone. Because when you fix the gaps we have analyzed, you are not fixing it only for the women, you are fixing it for everyone, and you are improving the health outcome of our country or our people, the client, the patient that we give services to. And one way we can do that is to address the gender pay gap. There is need for government to, sincerely conduct a gender pay audit and implement transparent salary structure, equal pay for work of equal value, regardless of which cadre or which profession. It should be equal pay for work of equal value. And government need to recognize and value unpaid care work through appropriate policies and compensation. The unpaid care work women do in taking care of children and the elderly in their homes and in their communities must be recognized, and a way of compensation should be, designed so that it will ease the burden on women. Then there is need to promote women in leadership. And this also falls in the premise of our trade union. Unions must promote, involvement of women in decision-making, in leadership, in collective bargaining. Issues around women must be included in collective agreements. And, there must be ways for unions to build capacity of workers when it comes to, leadership. There is need to implement targeted initiatives such as mentorship program and leadership development opportunities for women. And there is also need to challenge gender stereotypes and biases in leadership selection. And we also need to ensure active involvement of women in decision-making process at all levels. And another very important strategy is the need to improve working conditions and work-life balance. Government should implement policies that support flexible working hours, part-time position, and remote work options. Provide adequate parental leave, like maternal leave or paternal leave, and support for new mothers, e.g. crèche in our workplaces. Addressing staffing shortage through increased investment in the health workforce. This is non-negotiable in this century. There is urgent need for our government to increase investment in the health workforce through training, opening up opportunity for training of more healthcare workers because of the shortage that we already have. There is also need to combat discrimination and harassment by implementing strict anti-harassment policies with clear reporting mechanism and ensure prompt confidential investigation and action. There is need to strengthen social protection and rights. And we can achieve this by ensuring universal access to social protection system for all health workers. including those in the informal sector, by promoting collective bargaining and the organization of female health workers into trade union. This fall also in the shoulder of our trade union. And we need to enforce legislation that protect workers' rights, including minimum wage law and safety regulation. So another point or strategy I will mention is the need to invest in the health system. Increase investment in robust public health system to improve working conditions, reduce workload, and ensure universal health coverage is of very, very utmost importance. And need to recognize that investment in health and care work not only accelerate progress on universal health coverage, but also redistribute unpaid care work. Last but not the least strategy is gender-sensitive data research. We cannot accomplish, improvements in gender equality and also decent work for women in the health sector without a gender-sensitive data research. We need to prioritize research that applies a gender and intersectionality lens, including sex and gender disaggregated data, and move beyond describing inequalities or inequities to evaluating the impact of gender transformative intervention. I believe that by addressing these challenges comprehensively and implementing the strategic intervention, we will be able to improve at least to, a very, very decent measure the situation of women, especially when it comes to inequality in the health sector, and also provide decent work, for all in the sector. I want to stop here. I don't know if I was waiting for Baba here, whether my time is up, I can continue.
No, you are not. I would have coughed if it was already time up. But anyway,
Okay.
go on. If you're wrapping up, that's also fine.
Yeah, I just want to wrap up by saying that women and the health system is an age-long thing. Before even the present stage of women productively engaging for salary work in the health, women have always been historically in the, according to the gender roles they perform in the society. Women are historically assigned by the society norms and values and culture to providing care, nurture children, and also provide support for their male folks while the men go to work. The women take care of the home. So, and I think it flows into the current stage where women take more roles in the care sector. And this should not be a disadvantage to women, but it should be celebrated and encouraged. At the same time, opening up room for more engagement of women in other sectors that are termed or looked at as a male-dominated sector. So on this note, I will stop and allow for further discussion and questions. Thank you.
Thank you, Abby, and very characteristically profound and deep. I will not try to summarize because I already see a hand or two already up, and we want to keep these as interactive as possible. So I'll call on my good friend who's under I see up, Comrade Isiako Sabo Safe, a former state chair of the Medical and Health Workers Union, also a former state chair of the Nigerian Labour Congress in Zamfara State. Comrade, been a while. You're welcome. You have the floor, Comrade. Let me see.
Thank you, Comrade Aye, and Comrade Badru for the presentation. Even though the presentation have taken a long time, I was thinking it's going to be interactive. Maybe you'll be stopping at each of the subtopic. But anyway, you have done well and you have done justice to the topic. My only concern is you are too lane on one side. I am he or she, but the issue in the health sector, it has peculiarity. In other clans, women are more in the sector. In our own side of the country, men are more in the sector. We are more in the sector than women, and that gives rise to a lot of issues. One of which is, like you mentioned, the issue of unemployed and underemployment, and so many issues. But specifically, we need to address the issue of women in the sector. We need to push. And what I mean here is we need to do whatever it takes to push them to go to school and play a role in this sector. Most of the rural areas in this part of the country I came from, women are being attended by men, including in the labor room. Comrade Badru was carried away because he's a nurse by training, that there are more women nurses than men. But for me, from my own background of having managed to manage multiple health workers, we realize there are more men in the sector than men, especially in the northern part of the country. So I think that has to be addressed. On the issue of equal pay, well, we are, as it is now, are being paid equally, but the workload is different, like you rightly point out. I want us to start clamoring for a new allowance called labor work allowance. Those that work in the labor room should be paid a different allowance. We are all health workers, we are all being paid hazard allowance, all other allowances are being paid, but I want this one to be specific. Those that are working in the labor ward or labor room should be paid an extra allowance. They are doing an extra work because if you pay them well, you expect them to do well. Even though women are trying, but we need to encourage them to do this work. And I'm sure this sector, as it is now, I don't want to say it's discriminatory, but it is becoming that. It is becoming discriminatory. Most of the top positions, if you count the number of MDs and CMDs in our hospitals, men are more. If you count the number of officers in charge of our PhDs at the rural areas, men are more. So I think we need to address this as an issue. There has to be gender balance in that. But apart from that, on a whole, in the health sector, we are more gender sensitive than other sectors. That I'm sure of. Because when you go to other sectors, you will see disparity, gender disparity. But in the health sector, we're more gender sensitive than others. But taking into consideration geographic location, those of us from the extreme north, for instance, people like me from the northwest, were generally patriarchy. That makes men to be feeling superior. But in spite of all that, in the health sector, we still try to maintain some degree of gender balancing. Thank you very much, comrades.
Thank you, Safi. Yeah, and I saw a question or that hope it's been recorded because of some technical problems, which we know some comrades had with coming in. Yes, it's been recorded and it's also been live streamed on Facebook as we speak. Unfortunately, one of the persons that had challenges with logging in is the second presenter, who is a chief nursing officer, Nurse Anya. We're keeping our fingers crossed she'll still coming, but we'll have an interactive session. I have some things, some views with regards to some of what Comrade Safe said. I agree with some, I disagree with some. I would engage with some, but I see also Kelvin Zandorf. Kelvin is the chair of the African region for Industrial Youth Committee. And the first two speakers are men. It's also comrades, please. I don't want to call out names, but yeah, Kelvin will have the floor now. But I hope to also see hands up from some of our sisters and comrades. Yeah, Kelvin, you have the floor.
All right, thank you very much, Komodobai. And I want to say a very big thank you to Comrade Moradike Badu for that, very insightful presentation. But my question would be looking at the very gendered nature of how the health sector is, not just in Nigeria, but also globally. You look at how women, a critical mass of women are in that sector. But then you then still have this disparity when it comes to the medical doctors, the health workers, the nurses. Yes, there's a gender nature there, but then there's also this classification within that health sector that sometimes reinforces some discrimination, some stereotypes, even amongst the health workers. So I don't know if my question just to establish is how do we try to understand that dimension that happens within the health system where you have doctors, maybe male doctors, and sometimes they want to oppress or they want to undermine nurses within the health. They want to undermine nurses, within the health system. So how do we relate to that? That will be my question for now. Thank you very much, Comrade.
Thank you. Good question. I saw Precious hand up. Abby, let me know if you want to respond to questions as they come, or you want to take them together. Either is fine. Precious, yeah, I saw your hand. You have the floor.
Okay, good evening, presenter, good evening, comrades in the house. I don't know if my voice is loud enough.
Yeah, it's loud and clear. It's loud and clear.
Okay, thank you very much for the privilege. Thank you very much, the host and co-host. I really appreciate this outing, and the truth is I came in when a question was thrown to the house. And I don't know if I'm very late, if you've gone very far with the meeting, but I want to quickly react based on the question that was thrown, and it's actually something I've been willing to talk about. So if I don't know if I heard correctly, why in the health sector it is more gender sensitive than every other sectors. Based on my experience, from personal experience, I want to quickly react to that. The truth is, in this part of the world, especially in Nigeria, due to religion disparity and cultural sensitivity, a lot of people tend to bring in gender bias when they have health care providers attend to them. From experience, like I'm using myself as a case study, when I went to the West, when I got to Lagos earlier to practice, I knew what I passed through I'm a registered midwife. As a young midwife trying to fit into the field, I knew what I passed through before I got a job. Basically, when I go for this interview, when I submit application, they ask me, are you a male nurse? Are you sure we can employ you? You know, I got such responses from a lot of employers, and this is because of the fact that a lot of women, basically the religious women, the Islamics, they prefer to be attended to by a female nurse rather than the male nurse. And I know this experience I also experienced by other healthcare providers in the health setting. So I don't blame them. I don't blame the health sector for having gender sensitivity, owing to the fact that the recipients of our services are gender biased. You will see an Islamic woman wanting to be attended by a female nurse or a female doctor. So that's my opinion on that. Thank you very much for the opportunity.
Yeah, thank you. Just also to point out, and I mean, I'm happy you're a nurse. I've been also in the health sector now for a significant number of time, and I don't think it's only either Islamic or even only on a religious basis. You have similar things with probably Christians, and even, and I'm talking of not only in Nigeria, but gradually you have, but I think it's also kind of partly part of a broader question of how the health sector is taking on first. For example, the same person, be it Muslim, Christian, that might have issues with a male nurse, wouldn't have that same issue with a male doctor. Or even if they're not that, but it's more likely, it's also part of that idea of feminizing nursing, and not only feminizing it, linking feminization with subordination. You know, what is supposed to be the bigger, the more that kind of thing, it could be a male. So there are a number of things that the issue go with gender equality, that go with decent work, that go with the struggle for working class liberation. So yeah, I'm happy hands up now, even though it's still male. Nurses, Precious is a nurse, and also Nurse Breeze, the nurse tutor who has stood up against repression. We're happy to have you here. You have the floor. Nurse Breeze, you have the floor. The nurse tutor from Ilaro, the School of Health, School of Nursing, College of Nursing. Yeah. You should be able to unmute yours. Okay, you should be able to unmute now.
Okay, thank you very much. I don't know if you can hear me.
Loud and clear, comrade.
Standing on the existing protocol, I greet you all. It's a wonderful time that I am amongst the people that are in this correspondence. Well, a quick one. I'll have to talk little about the discriminatory parts of the health sector, and I'll be using nursing as a backbone. I'll be talking mostly about nursing. I feel like nursing has been perceived so much to be a feminine profession. And the people before us, who are the nurses before us, are not doing anything to help deconstruct that perception that the society have had. Example, when I was doing my internship, I was already a midwife. I was a nurse, I was a midwife also. But I was in an antenatal ward where, although in northern Nigeria, where I was supposed to participate in one procedure called vulvar irrigation. But the patients whom I took to the theater to undergo a surgery of a repair, episiotomy repair, after a period of time, I took the patient to the theater. I brought the patient back from the theater. Two medics who are male medics did the surgery. And when she came back to the ward, in the antenatal ward, when the medics come for ward round, they come with male house officers in collaboration with nurses also and me. That patient, I remember that patient never complained for one day in the presence of the medics, who were men, that she doesn't like the presence of that male nurse amongst their team. But when it was now time for our team, we nurses, to do a procedure, and that was an opportunity for me to learn something I never learned in school, which is vulvar irrigation. The patient said she doesn't want me to be part of the team. But that same morning, the patients, the medics and me and others were part of the teams that did ward round. But subsequently, when I was supposed to be a part of the team, nurses that comprised only nurses, and I was the only male nurse, the patient said she doesn't want me to be part of it. And my superior then couldn't defend the profession. Yes, she couldn't defend the profession. In fact, the matter was so bad that I had to tell my in charge then that I don't want to enter inside the patient's perineum, because that's the language she used on me. Why are you angry? Do you want to enter inside the patient's perineum? So, but I told her that it's unfortunate that we couldn't defend the profession to the best of our ability, owing to the fact that it was a medic, two male medics that did the surgery. So I feel like that the people before us are still not helping matters in this in the health sector, because there are some things that they need to demand for. These things are not given, these things are taken. That's the truth. Nobody will give it to you. You have to take it yourself. Even international law organization, they know these things. Sometimes there are some things we need to take ourselves. We don't wait for it to be given, because it will never be given. That's on that side. Then secondly, I want to find out, is it because of the challenges that most of the nurses before us or the nursing profession is facing in the hands of the sister professions like medicine that upgraded to 6 years and are running MBBS, dentistry that are running 6 years, pharmacy that are running DPharm 6 years, physiotherapy that have keyed in to still run 6 years, and MedLab, who just keyed in on the 2nd of April to run 6 years, who are now doctors, who will become residents, whatever, and consultants in the future, and head the health sector. How do nurses want to key in? How do they think they can be part of the leadership when they are not ready to take the bull by its horn? That is another thing. For you to be a leader, you have to have what it takes to lead, even in the family. For your wife to be submissive to you, she must see leadership qualities in you. And if you don't have the leadership qualities, she can't give you that space to lead her. That is on the side. Now, the women, the people before me in the nursing profession, who are ladies, who have made found their ways to the top, I want to understand, they find it difficult to stand up for what they should stand up for in the hands when they are in the front of medics, be it a female medic. They don't cough, they don't talk. Hey, doctor, 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 they answer. But when they come down to the young nurses, who are they are the future of the nursing profession, that discrimination they face, they pour it on us. Yes, it is practical. They pour it on us, especially when you are a male nurse. They feel insecure. The patriarchy, the perceived patriarchy that is hovering around the health sector that they can't stand up to. When they now come into the profession, they fall back into the profession. That grudges that they have with the medics and other people whom they perceive that are subduing them, they pour it on with the young ones, especially when we are men. I think something strategic needs to be done about that. And the other thing I want to still talk about is, I believe that nursing and the health sector generally in Nigeria was designed on the backbone of religion. Firstly, Christianity. That's why in nursing there is a cap that has a cross. The ambulance has a cross. Now, I'm opportuned actually to have an Islamic blood and be in the northern side of the country for a long time. The North, from one of the comrades that spoke earlier, I salute him. He said something. He said in the North, men are more predominant in the health sector, and that's the truth. And it's of recent they started pushing their female who are Muslim sisters to go for education, medicine, nursing, medlab, and the rest of them. And alhamdulillah, they are growing in that sector. They did that so that they can bridge that gap of actually the religious side of it, because religion is a fundamental human right that no one should tamper with. I can remember the time the Muslim community fought for hijab wearing in the health sector. And it got down to the level that a Muslim community, MSSN, sued Lagos state government down to Supreme Court. I think that judgment was delivered 2 years ago. And today, my Muslim sisters wear hijab in every sphere of, not just in the health sector, in the police and in everywhere. But what now happens that they forget that there's a third wheel, and that third wheel is the traditionalists. There was African traditional religion before the advent of Christianity and Islam. And these same people also needs to be recognized and represented. And upon that premise, one should not, because of his religious affiliation, try to use what we call public service rule, or one rule or the other, or institutionalized policy to rob another person of his religious rights within the health sector. Because if my patient has a right as a Muslim to express herself and choose who she wants to attend to him, then I, as a nurse, I also have my right also, as regards to religion, to express myself also. I think we need to look into these things within the workers' committee, within the labor force. We need to look into these things within the health sector for equal and equitable distribution and representation of people. I think I'll stop at this place for now. Thank you very much, sir.
Thank you very much, Breeze. And as I always say, I'm not a knight. Comrade is much more distinguished than Sir, in my view, in every way. But that's aside. Just like, and we're going to have an interactive session. For now, I don't see any hands up. I want Deke to speak to some of these. I also want to speak, but the one the speaker. But there's one thing I must immediately respond to. I agree with some of what you have said. I would engage with somebody. There's one I must be upfront about seeing as not even only because we're talking about gender equality now, but also because I think as activists, we should be very clear about some of these things. The issue of your partner, be as your wife or your girlfriend or friends, having to be submissive. I think that part of what we should be looking at is seeing ourselves as partners, working together. I mean, respect is reciprocal, and submissiveness is not only like, for example, I said the thing is, I so much stand with the words of Oscar Wilde. I said, look, disobedience, is the engine room of progress. And by that is that we should not look for submissiveness. Strong men don't even look for submissive women, in my own view. You look for someone that also and it's not as if, even submissiveness, there's a saying in Yoruba that prostration is not respect. So if you think that someone is being submissive, it might even be a strategy to let the mad person be carrying his own madness or what have you. Rather, we should meet each other in a position of mutual respect and engage with. To me, that is a very, very important thing, irrespective of the nature of the relationship. So anyway, let's get back to the topic itself. I don't see any hands up for now. Unfortunately, Nozanya has still not been able to join due to tech issues. I'm sure we'll have her some other time if for any reason she still can't get in. She's been trying. I don't know. It's unfortunate. She actually had slides ready and all that. But Abby, you might want to respond to some of some direct questions, like from Kelvin. Then there were interventions from Safi, from Dries, and also Precious. And I look forward to other hands while Deke is talking, so that interventions and all right.
Yeah, thank you very much. I want to commend our comrade from Zamfara for, the intervention and, pushing it out there that in the core north, definitely there are more male healthcare workers than women. I think he has said the obvious. And I think also as a result of that, there was a project, I don't know if it is still ongoing in Nigeria, that is called Women for Health, where the donor agency and the local NGOs are supporting education of the girl child from secondary school up to, college of nursing or to the community health college colleges in the North. And I also appreciate the fact that he said that we need a labor ward allowance. I think I'm up for that. If the trade union could also, ask or demand from government to give special allowances for healthcare workers who help women to, support women to give life, because the act of, delivery itself is the act of giving life. So it will be very, very, interesting to see that. And I also support his assertion that it's becoming discriminatory, that we see most of our hospitals being led by men, even among the medical profession, who are, in quotes, claiming to be the lead in the health system. You will see that there is also discrimination within that, within their cadre, also in terms of allowing or giving room for more women, to be in leadership. And I want to say that we are in a patriarchal society. Whatever system we build, we are part of the society, first, before we, be within that framework. So whatever it is that we have imbibed in our community life as culture, tradition, naturally flows and follows us even into the workspaces, workplaces where we find ourselves. And we need to really, really address the deeply entrenched patriarchal system where we function first. And this will ease the tension in terms of leadership, and also spaces for women to function in leadership in our cadres, in our workplaces, and also more specifically for this discussion in the health system. So according to Kelvin, he's asking, or he wants to know why the classification that enforces stereotypes. How do we understand the dimension of oppression in the health system, looking at the gender nature of the health workforce and the disparity between medical doctors? Yes, I want to say that the care work itself, the word care is very synonymous with women. But like I said, the gender perspective of, women doing the care and men giving the instruction of how the care should take place, has that division in it, that dichotomy of men being the one who give decision on how or who should be given what, and it is strictly patriarchal. Research has proven that a woman can equally give those instructions. We have female doctors, we have male nurses. So it has got there is that intersectionality well entrenched in the cadres and the different professions within the system. But our deeply patriarchal system still reinforces the stereotype that the men must be the lead. And when you look at the medical profession compared to the nursing or the community health profession, you will see that we have in position of leadership more in the medical field. So that is a stereotype we need to talk about, we need to continue to have conversation about, and we need to deconstruct. We need to deconstruct it so that we will be able to provide equal opportunity for everybody to express themselves. As also in terms of leadership, it is only, in this climate that we think one profession must specifically be the lead. It is not so in other climes. We've had, the nurses lead the entire United States health system. We've had in so many other countries where even the nurses are given more credit in terms of, what the deliverables when it comes to the health outcomes in those societies. So it is, short-sighted to generalize and say that, it is only the doctors that are leading. Yes, we have it in our own clime, But that does not mean it cuts across the whole world. No, it's happening in our, an administrator could be from any of the cadre of professionals within the health team, the health team, and could lead, as the case may be. We have a challenge of patriarchal and high-handedness because of the stereotypical belief that it is the men that can lead in our society. And that is what all of us have to deconstruct and continue to discuss until we are able to break that stereotypes and move forward. So it's like the proverbial glass ceiling, you know, when it comes to women advancing in their career. Then my comrade Brice, you have put a lot of things out based on your personal experiences. And well, I cannot erase your personal experience because they are all yours. But, you know, there are some discussions that, you know, I would like to engage you one-on-one, but I wouldn't want to dabble with, because here we are talking about, you know, the generalized, you know, form of gender inequality. There are some I can categorically talk about, like, you know, when you mentioned that maybe the healthcare cross is about religion. The cross does not have anything to do with religion. I don't think it's because it's Christianity, because we have the Red Cross and we have the Crescent also, and all of them are INGO, you know, and they are working. And let me be frank with you, this does not know anybody's religion. Disease does not care whether you are an idol worshiper. When you need a healthcare, you need a healthcare. And the moment we begin to separate this issue and see humanity for what it is, the better we all, you know, we will be. The better we'll be able to render our care, work with our colleagues, and also achieve, you know, the optimum, you know, care, the quality care that we are you know, we have sworn to render to our clients, our patients, as the case may be. So I think we need to steer clear of religion and talk about the quality of care, how we can improve our health system, how we can render quality services, regardless of who the patient is, or regardless of who our colleagues, you know, or the people within our health team. It's a lot of discussion you have raised, and more particularly, you know, there are a lot of accusations out there about how the senior are treating the junior, and it's difficult to discuss, really, because they are your experiences. But what I would say is that in all that we do, we should put in congruence that the most important person in the health system is the patient. It is not about who we are, the cadre we belong, the work we do, our academic you know, records or academic achievements. The most important person is the patient, and we have the responsibility, duty of care to give that person the optimum care that is within our reach. And a patient have rights to determine who takes care of him or her. A patient have that right. And as a healthcare provider, we have the right to, you know, to respect that also, unless there is, you know, urgency and there is no more, you know, there is no more options within our reach. You know, we need to respect, you know, the right of the patient to the kind of care they want. If, for instance, if somebody is a Jehovah Witness now, we know they don't take full blood. We can't force it down on them because they need it. We have to respect their choices. So there are lots to that debate, and I don't think it is what we should do here, because this is not about nursing alone. It's about the healthcare, you know, system. It's about, you know, gender equality. It's about decent work, social protection for health workers, and it's about deconstructing the stereotype that is not giving us, you know, making us to make progress when it comes to, you know, the health outcomes in our country and in our societies. So let me stop here. I think there is room for bilateral, you know, discussions after the program. Thank you.
Thank you very much for those responses and further interventions, Abby. We can take another round. Whilst waiting for hands to go up, I'm happy to also join the discussion. Yeah, a lot of what Safi said are not only apt, but they also point out how the issue of gender inequality in particular health sector fits into the broader picture of gender inequality in general. And I see Safi's hand is up. So come back in, comrade. Let's hear you.
Well done, comrade. I want to make this contribution that the Women for Health program, which I'm happy to be part of, we drew the program for the northern states, and it works. But the only problem is they have concluded the project. It was a USAID sponsored project. It's supposed to be a 5-year project. It has helped a lot of women. It creates demand for the women to attend to colleges of health sciences and nursing. We thank God for that project, but it's like it creates a vacuum that we cannot fill. And what they do, bringing in a lot of women into the system, now others cannot. And government is not willing to do that. So I think I would advocate if we can have another agency that will be willing to do same role. That will be very good. And for other issues that were raised, I think I would advocate that we fix another time, discuss more, have more time, because this is the first one we are having. Comrade Badaru, I would advise if we can make this a series, maybe once in a month or twice in a month. Let's see between now and end of the year if we can sensitize as much people as possible so that they will become advocates. It's just not enough for us to discuss at this level and leave it at this level. Let's start going for fiscal advocacy on issues that are raised here or agreed or discussed here. Thank you, comrades.
Thank you so much. So you hit the nail on the head. It's not enough to interpret, to discuss, but how do we link it with concrete action? Comrade Florence! Yeah, Comrade Florence, you have the floor.
Good evening, comrades, and thank you for this webinar. It's very informative, and I've learned one or two. I've also learned the challenges about the nursing area. And I agree with the comrade who have just spoken now, because that was what I was trying to also say as well. That beyond speaking here, what are the ways of how we're going to implement it on ground? In my opinion, I think most of the time there are policies that are made or put in place, and other to implement those policies, we also add it to trainings, maybe quarterly or yearly training, so that people get to know the how these issues are being solved. For example, the area of discrimination and how to approach it. Also, I would like to advocate that there be something like posters or flyers to also make a public awareness within the premises of the healthcare to say, okay, we frown against this or so any form of sexual harassment to our nurses, and we frown against verbal abuse. As much as we, the workers, would respect you, we would expect the same respect from you. And these are just my own suggestions. Thank you.
And thank you for those excellent suggestions. I mean, those are great interviews. Thank you so much, Comrade Flo. And you reinforced what Comrade Isiaku Safe said, the need for two key things. One, how to link talk with work. How do we work our talk? For example, for me, like this idea of the USAID has left with these women in health program, which Deke raised and Safi also spoke to. We should demand that the government takes it up. You know, a significant amount, I think 200 million naira, I can't remember the exact figure, was added to, there was a supplementary addition to the earlier budget after the USAID things were cut. The question is about priority, and I think it was Nurse Breeze who was saying, I mean, you need to take it and not just, we need to demand. It shouldn't just be the federal government determining what is priority, and some of what is priority to us should be those programs that promote gender equality, should be those programs that promote, you know, the right to health of people, including, you know, improved maternal health and child health. And these are linked not just only with provision of healthcare, but also the issue of health employment and improved working conditions and gender equality and decent work. These are all intertwined. So there's something I wanted to say earlier with regards to what surface, and which is true, that I mean, and it's not just even only about health. You had the girl child, especially the girl child of working class families, the girl child of, you know, peasant families, you know, not having access to education much. You could, I mean, the governors, you see them, they send their children, male, female, to the UK, to the US to study and what have you. And whether they study or not, even you have alliances made with marriages and things like that. It's usually the girl child of working class people. And the way at times religion is used to reinforce some of the less progressive things. And it's not only Islam, like what's Breeze was saying, which I spoke to, this issue of submissiveness. It's part of, you see it in one of those letters that Paul wrote in the Second Testament. But at times this is taking things out of context. There's one thing I always say, and when I say it, I notice that many people in the South, even some in the North, are not aware that one of the most enlightened woman in what is today's Nigeria at the beginning of the 19th century was the daughter of Usman Dan Fodio, Nana Asmau. She was a poet. She wrote extensively on, you know, the collection, the translation of her collected work. She died in, I think, 1864, 1863. She was around 70 years old then. And she started writing pretty early. Her collected works, the translation runs into almost 1,000 pages. We're talking of the early 19th century. So it's not, I mean, and we're talking of the daughter of Usman Dan Fodio. So that tells you that the idea that was, you know, hegemonic of that the girl child does not need to be given to education or so is an invention. Is an invention to feed into patriarchal designs. And it's not, so that's something to take due note of. But part of what takes us today is that in understanding what are the questions in terms of gender inequality in the health sector, we need to situate it within the broader context, both nationally and within each local environment. And a lot has been said, and I don't intend to either repeat the responses or, I mean, it's an interactive. I also want to draw out a few things. I think it was Kelvin, the issue of the schisms between doctors and other health workers. It also came out in a number of things, and it reminded me of a couple of things. One, a number of us would know Professor Festus Iyayi, bless his soul. He delivered the paper at the second Medical Health Workers Week, which I had the honor of organizing then. That's like 18 years back. And he talked of professionism, not professionalism, professionism, what some of us would describe as professional chauvinism, and how it undermines teamwork. Look, irrespective of who, without the team working in the health sector, health cannot be delivered. The surgeon cannot carry out surgery if attendants, cleaner, no clean this thing, not to talk of the nurses that have to work with him or her in the in the theater room. You know, everybody has a role to play. But when we zoom in only on doctors, it's not only on doctors. It's just that, yes, you have it much more there. We need to forge closer relations. It's with, like, for example, you see, pharmacists did everything possible to make it impossible for the School of Pharmaceutical Technology in Yaba to work. Because, I mean, they can live with pharmacy technicians, but pharmaceutical technologies were too close to the district. Also, you have had with nurses and community health practitioners, and at times you see some members, don't forget, I mean, I spent almost 30 years as a full-timer trade unionist in that sector. You know, and you have at times also that you see these nurses, when they finish their nursing this thing, they'll now go and do MPH, or even doctors too, that the doctor, they now do MPH, a master's in public health. And then we that are the primary health keeping, masters in primary health care people are shoved aside. So you have these contestations, you know, and it is not only in Nigeria. It's not only in Nigeria, especially that of the doctors and the rest. You have something similar in the education sector to it, say ASU and the other union. But part of the thing is the ideological orientation of ASU helps to smoothen this. And this is also why it is important, you know, to deepen class consciousness as against crafts union consciousness within the health sector. Because we have a shared concern. It's not going to be easy, and it will not happen artificially. You need to build trust. You need to. I'm proud of the fact that, I mean, I'm talking of in the early 2000s, like 2001, 2002, when I was a field secretary in Ondo State. We worked closely as Medical Health Workers Union, as NAM, and as NMA. Then Francis Fadri, who would later become the NMA president, was the NMA chair in Ondo State. But that was also partly because we had a long history of working together from our student union days when, you know, I was speaker at the University of Lagos, where, you know, he was a member of the parliament in also which I was presiding over from the College of Medicine. So these are some of the later became vice president of the students union day. So these are some of the things that are coming to play. There's the need to build trust to forge going ahead together. And the question of what is to be done. Yeah, Florence, I'm happy, please. And any other one to raise your hand. I'm talking partly as a filler role. So Flo, please roll. Take it on.
Sorry, comrade. I just wanted to ask a question. With regards to sexual harassment, because it keeps coming to me, we have that issue as a national issue, not just in the nursing or medical or healthcare sector. An example is what happened at the National Assembly, and we saw how that's going right now. What every trade union is going to do about this? Because if it can happen and is being gotten away with at the National Assembly, what kind of implementation would the healthcare sector be able to do? That's my question. Thank you.
Very good question. One, we must have zero tolerance for sexual harassment. And I mean, I don't like reducing things to this Gandhian, be the change you want to be, but it's part of it. Even our unions should have sexual harassment policies to prevent and punish sexual harassment where it happens. Our workplaces, it's good you raised this, as unionists in our workplaces, we need to demand for such. And that's why I started with that. Even our unions have to have such. And we as activists in our unions need to demand that our unions should have such, because it also gives a moral right for us to then demand of employers that the workplace should have such. But that is not just all. We need to, because there's the ideological dimension to it. You cannot, and there's a political, but which has to do with patriarchy, suppression of thinking of women as second fiddle and things like that. And we need to emphasize the place of power in sexual harassment. And because even amongst us, there was a debate. I wouldn't even call it debate, because I did find it nauseating when you meet some kind of views in some places you don't expect, where you even had some, otherwise radically minded person saying that you cannot always blame people that harass women if a woman is dressed somehow. What immediately came to my mind, that what's this person saying? It's not about what the person dresses. It's because you think you can get away with it. If somebody is even totally stark naked and carry AK-47, and you know that if you dare touch the person, you are dead. You won't. Even if it's not AK-47, if the person is your boss, and you know that if you touch the person, you lose your job, and you don't have any other job, and you have to put food on the table, you will control whatever is behind your zip. So it is not about the woman. It is about power. It is about, you think you have power to be able to, do such bombaclat and get away with it. So we also need to make sure that it is clear that people cannot just get away with such nonsense. So these are, I think, are some of the key things to put in perspective in that regard. Yeah, and as I said, it's an interactive thing. If there are it's a discussion, I don't see any other further hand up. And unfortunately, we regret to point out that Comrade could not resolve the technical issues. But I'm very, very happy at some of what have been said, including the need for this to be regular, and we intend to do that. We also have here some of the officials of the Workers' Rights Campaign. I see now only the secretary, who had also earlier spoken. He would also, I'd invite them to talk. But the thing is, I mean, I'm just a member. So is that we do appreciate the place for us as working class activists, trade unionists. I mean, there are working class activists that are not trade unionists, and there are trade unionists that are not working class activists. But for us in this manner to stand up and fight for workers' rights and against all forms of the rights, the violation of workers' rights as workers, as men, as women, and issues of gender equality, also trade union issues of climate change and trade union, and how all this relate to workers' rights and our struggle for the liberation of our class. I see Precious hand is up. Please come on, comrade. Yeah, you have the floor.
Okay, thank you very much. Thank you very much, Chief Host. This is a very interesting webinar I've been looking out for. The truth is, I got attracted to join the webinar following the Workers' Rights Initiative, not necessarily the gender equality. So on that note, I want to ask a question I've been asking myself for a period of time now, and I've asked some couple of people who have made research about it, and I'm yet to get a satisfactory answer in that regard. So I want to know, it's not actually related to what we're discussing today. It's actually related to credentialing for a worker. So this experience we get, I don't know if other healthcare providers have this experience, where you get employed by the private sectors, the private institution, the private hospital owners. When you get employed and you get relieved, maybe probably you are sacked or you are suspended or you resigned. But whatever the case may be, and the employee is relieved from duty, and this person is no longer in contract with the employer. So we find out that most of the time, especially for we registered nurses, most of the time, when the hospital accreditation bodies go for inspection for their accreditation status, they still present the credentials of that employee that was relieved, that employee that got sacked, or that employee that resigned. They still present that employee's credentials like licenses, registration, certificates, photocopies of this of their credentials to these bodies that are coming for inspection. So my question is, under the law or under the in the rights of the employee, is this supposed to be so? Is this supposed to be obtainable that when an employee is no longer in a contract with an employer, the person's credentials are still active for any form of inspection or accreditation by the hospital management board? So I want to know, is it right for these employees to still make use of the employer's credentials even at their absence, and most of the time without their consent? Thank you very much.
Thank you. My immediate answer to that is, I mean, this is fraudulent because that contract has ended. It's like what it's like what you see with juggling things for accreditation also within some private schools. I remember Wolex Polytechnic in those days. You know, it's now 19. So others too could want to speak to this. There's a hand up. In fact, that hand up, I was, you know, when I saw Precious and I cut short my Dogo Durenchi because where I was building things up to was that, yes, we'll be having monthly things, but that, I mean, this first of the webinars we're having at WRC is in conjunction with the Elegant Nurses Forum. The Elegant Nurses Forum brings together nurses with a commitment, you know, to struggling for improvements in the economic and social well-being and welfare of nurses. In the couple of years it has been established, it has fought for the number of nurses that were victimized. It was also at the fore of organizing the resistance by nurses against the draconian, what is it called, verification procedures that the National Council of Nigerian Council of Nurses and Midwives, National Nurses and Midwife Council of Nigeria. I remember small now. So, and the coordinator of the
National
ENF.
Association of Nigerian Nurses and Midwives.
No, not NAM. It was the council that does verification, not
okay.
The
Nursing and Midwifery
National
Council of Nigeria.
National, Nursing and Midwifery Council of Nigeria, NCN. Yeah, NMCN. Yeah. That was what not NMCN. Thank you. So, and that person is Olamide Thomas, aka Olamide Africano. Irumole one, Buru Buru. Comrade, you have the floor.
Thank you very much, Comrade Babayi. I just want to say a few things to what that person said last. I've said it on some nursing platforms that is intellectual property fraud, and the person actually has the right to sue the establishment and request for compensation.
Facts.
Because I've said it several times on some nursing platforms. So, information cannot reach everybody. And we also said it. Oh, sorry, I'm sorry, Nurse Precious, I'm very sorry. And I also said it that time that if nurses who just left school School of Nursing and are seeking employment, they are not meant to submit their license or photocopies of their license. No, it is the CV they should submit, because it has been noticed that some of those hospitals take advantage of just graduated naive nurses and take advantage of them. Even without employing them, they collect their credentials and use it for their own hospital registration. So we've said it times without number that even if you are employed and you want to give them, you have the right to give them copies of your license if you have been employed. But you also have the right to state that they must pay you your deserved salary, and you also have the right to draft your own terms and conditions to them because they will be using your license for registration. Thank you very much.
Yeah, I see Nurse Precious and is up again. I don't even joke later. I say, quit the verse. You know, they say I've been Nurse Precious. Anyway, you have the floor. Yeah, and make me, yeah.
Thank you. I know verse. So, the
Okay.
truth is, how I want to quickly react to Nurse Halamide, and I want to ask her a question. You know, I said earlier, if the nurse is relieved of duty or the nurse has terminated the contract with this employer, how does she know or how does she retrieve back her credentials after the employer has already photocopied and maybe probably filed? One, how does she know that her credentials or his credentials are still not in use or are not in use? Then secondly, what are the HEFEMA, those that are in charge with with accreditation of hospital, those board in charge, the HEFEMA and co, what are the measures they put in place to ensure that these credentials that hospital provides, that the owners or the people that the owners of these credentials are aware or they are present to back up whatever credentials that were presented to them during their inspection? Because I've witnessed most of the time when they come for inspection, they only go around to check, do you have emergency tray? They tick it with their rubric system. They only go around to check all those things. Do you have oxygen and the rest of them? But I don't see them checking or going through their list or their checklist to confirm that, oh, this is not Chinenye you provided. This is not Chinenye's credentials you provided. I want to see that nurse Chinenye. And so I've not experienced that, but so I want to know, how do they come to this actualization and conclusion that this person you're presenting their credentials are actually are actually are actually the ones that they are actually present on ground in this hospital and you are using their credentials for accreditation. Thank you.
That's a very good question. But okay, Olamide, yeah, come in.
Okay, thank you. In response to what Nurse Precious said, if you are no longer under the employment of such hospital, you have the right to write to a farmer, Ministry of Health in that state. So they will be aware that you are no longer under their employment, and if they are presenting your credentials, they should be able to request that, okay, we need the presence of this person. But as for asking questions about a farmer requesting for the presence of that person, see, we all know we are in Nigeria and corruption is everywhere, including a farmer. We can only do our own bit to ensure that our people are not, but that doesn't still stop the corruption in a farmer. That's it.
All right. What
And
I
that's
also,
why
okay, sorry, I thought you were through. Go on, please go on.
Yeah, and that's why we said each individual dropping licenses should be able to draft an agreement for the employer. In as much as an employer is employing you and will be giving you a letter of employment with stated agreements and rules for you to sign, you yourself should also be able to draft agreements for your employer that, okay, if you are using my license, this is my terms and conditions. If you are not earning well there, courtesy demands that you should not you should not drop your license. It's not compulsory. It's only necessary. It's not compulsory. Thank you.
Thanks. What I'll add to this, you see, it's when we talk in general sense, it's we might never be able to totally eradicate some things, but we need to use some cases to fight that general problem. I know, like when we were talking earlier, Safi, Flo, and a couple of us also still spoke about that. How do we tie this our talk with action? So I will urge you or anyone else, if you have identifiable case of such, because that's a violation of the right of such nurses as workers, as well as a crime against even the states, but it's primarily a violation of that. It's a violation of the right to privacy. It's a violation of the labor rights. So if there are such these things, let us know. We will take it on. If we fight it in 1, 2, 3 instances, many of those other people doing it will sit up and borrow themselves brain. So thank you for that. I think we've gotten to the end now. We'll do just a few things more. One, we'll have the resource person, our very own comrade Abi, Moradeke Abiodun Badru, to give last statements. There are other things that amongst what has been said in the subsequent rounds she wants to speak to, she will do that now. Then we have the secretary of the WRC and the coordinator of the ENF give some closing statements. Then as facilitator of the session, I'll close it. So we start with Abi. You have the floor for...
Yeah. Thank you very much, Babaye. I want to say that in regards to the case from Nurse Precious, if there are evidences, it needs to really help us by coming forward with those evidences. I don't know in which state this took place, but if it's in Lagos State, it can walk to the NAM office in Lagos State, to also report this, and we can see how the union can support. We have a very young and vibrant State Secretary, Toba, in Lagos State. And please, just keep us informed if those kind of cases are reported. We would like to follow up. We need to make a case so as to serve a deterrent to others who might be perpetrating such. So that's what I want to say about the case. And finally, on our case, I really appreciate how robust our discussions have been, and all the salient issues that have come out, and also the diversity of having someone from the North to also share, the perspective of the male domination in the health sector from that region. I think all these experiences are very important and germane to our discussion. And I want to say that the struggle for equity is a collective struggle. The struggle for, the protection of rights of every worker is a collective struggle. And also, before I forget, there is an issue around sexual harassment that was raised. And I want to clearly say that that is why for us, at the Congress, the Nigerian Labour Congress, and also all the affiliate union, we are embracing the Convention C-190, and also propagating it, making it popular among members and also ensuring that our members know their rights when it comes to, seeking the redress for sexual harassment, especially in the world of work. I want to say that NAM have taken up some, very, very hot cases of sexual harassment in the workplace, and we have won on some. But we also see in some cases where the person who was being abused will back out and say they don't want to go forward, with the case. So these are areas that we need to also explore. Why at the middle of the fight, the union is taking up the case and fighting, the abused person is now retracting and saying they don't want to seek redress. So it's important we also look at that. Anyway, I want to say that we have a collective fight. It's not a fight for women. It's a collective fight for equality, equity, respect of humans at work, regardless of their social, social economic roles, and also respect for humanity, human labor, and also, the improvement in the quality of care we give our patients. I believe that once we continue in this direction, educating ourselves, having this conversation, and going forward with it into actions, we'll be able to get there. Thank you very much.
Thank you for that, Abby. That was excellent. Merci beaucoup. So I will call on starting with the coordinator of the ENF, the Elegant Nurses Forum, Olamide Africano. No, it should be Africana. Yeah. Would you want to give some closing statements on behalf of the Elegant Nurses Forum for this webinar, the rich discussion? You have the floor.
Thank you very much, Comrade Babaye. In fact, it's been an educative and interactive session ever since the advent of Elegant Nurses Forum in 2017. I think now we are stepping up since last year that the Elegant Nurses Forum has been under WRC. We are stepping up with educational programs where we get to learn, interactive sessions where we discover lots of problems to address, and we say thank you very much to the WRC and the SWL, and also to nurses who are participants, and of course who have been following the ENF since way back from its inception. I say a very big thank you to everyone involved. Thank you very much.
Thank you very much. And I dare say that if you are a nurse and you are elegant, intellectually, struggle-wise, committed, the place to be is the ENF, the Elegant Nurses Forum. If you're not part of the Elegant Nurses Forum, join the Elegant Nurses Forum. And now I call on the Secretary of the Workers' Rights Campaign, who is also the Regional Chair for Africa of the Youth Committee of the Industrial Global Union Federation. Kelvin Ayemere, you have the floor, comrade.
Thank you very much, comrade. I think first, I want to first of all, appreciate Comrade Dike Badru, who has been with us since, for those very, very insightful presentation, putting the issues the way they are. I think I would quickly want to say that, yes, we had some tech issues that did not permit North Ironwood to join. And we hope that subsequently we are going to also have, since we are agreeing at this meeting, at this webinar now, to not just make this a one-off, but every month or anyhow we might look at it, we might be having also come back to speak to us. So the WRC, it's like, I know some persons might say, what's the WRC? The WRC it's an acronym for what stands for Workers' Rights Campaign. And it's a network of working class activists. What we do is that we understand that workers deserves better. What we do is to advocate, champion, and fight for spaces where workers' rights have been violated, where workers' voices have been undermined. So the WRC comes in within that sphere to fight for such workers. So we do that working with trade unions, we do that working with other radical groups, a radical movement within the country. I just posted on the chat now our email, the WRC email. There were some issues like what Nurse Precious spoke to. So some of those things could be sent to our emails, and they will do some very, very good follow-up as to engage some of those issues where workers' rights has been violated across the country. Yeah, I think having said this, I want to thank everyone for joining, and I hope that when we call for another webinar, we'll also have everyone here also join, because I think the discussion so far has been very, very fruitful, insightful, and we don't take it for granted. Thank you very much. Comments. Over. Bye-bye.
Yeah, thank you very much. Alongside with the email that Kelvin has posted, I've also put the X handle. Our handles generally on social media is WRC Nigeria. Kelvin might also want to share the WRC WhatsApp group. If anyone would be interested to join, you're welcome to join us in the discussion on the struggle for defending workers' rights and for promoting workers' interests. So, and yeah, we're just about a few minutes off the 7 p.m. Mark, and but even at that, we want to thank you all for the time, for the patience, and I would also particularly thank Abby. I know how busy she is at the moment, and for sparing the time. We so much appreciate that. Even though Nos Anyanwu is here, comrade, we appreciate the fact that it was beyond your control. I'm sure there are other webinars in which we'll also be able to have you speak to us and discuss. To every one of you, especially those that, raised questions, made interventions, both in speaking and also in the chat, and even for those that didn't, but which of course listened attentively, thank you. The struggle of the WRC, the struggle of the working class is about workers who create the wealth, having been, not just having, taking the respect, and it was Precious as I think Breeze, we don't just, your right is not just given, you have to fight for it. Even rights that we take for granted today, we're not just giving out of the benevolence of the bosses, is that generations yesterday fought for and won these rights. So let us think together, let us work together, let us act together, let us unite and fight until we win each and every step moving forward to the victory of our self-emancipation from the chains of the system, the capitalist system, and the bosses who benefit from it and who are personification of this exploitative system that is meant to squeeze the very life out of us as workers and to keep us as subhuman in relation to the bosses who appropriate the wealth that our labor creates.
Great.
Israeleto.
Yeah, Africa.
Amantla.
Away.
All right, comrades. Thank you very much once again, and we read it out.
Thank you. Bye-bye. Thank you,
Thank
Kevin.
you.
Thanks, everyone.
Yeah. Thank you very much, comrade.
Bye.
Bye.
Thank you. Bye-bye. Yeah, thank you.
Thank you, Precious. No dey vex.
Bye.
I know that, so.
I know. I just dey pull your leg. Nothing to you.
Thank you, sir. Thank you. I've joined the platform. I'll be looking forward to have a one-on-one conversation with you, sir.
Excellent.
All right,
Excellent.
comrade. All right. Warm regards, huh? All right.
Okay,
Cheers. Bye.
Bye.
Thank you.
Bye.
Bye.
Maputo, Maputo, home of the